Can you see this?
Yep.
All right. I was set up to do this with the slide projector. And so we're going to talk about anticoagulation therapy. Why is it important? Number one, for the prevention of ischemic stroke. Patients with AFib have 5 times the higher risk of stroke or CVA compared to those with normal sinus rhythm. Atrial fib is the most common arrhythmia requiring hospitalization. Prevalence of atrial fib in the long-term care ranges from 14 to 17% of your patients. That's about 1 out of every 6 has AFib. VT is the 3rd most common cause of death after MIs and CVAs. So we don't have 1/6 of our patients on Coumadin or something to really deal with AFib as well as we should. That's just awareness. We don't prescribe, but doctors should be a little bit more aware of it. Right. The number one thing we think of, number one drug we think of is warfarin or Coumadin. The indications that the FDA approves warfarin for are prophylaxis and treatments of venous thrombosis, pulmonary embolism. Prophylaxis and treatment of thromboembolic complications associated with atrial fib, cardiac valve replacement, and reduction in the risk of death, recurrent myocardial infarction, and thrombolytic events such as CVA or systemic embolism after myocardial infarction. It's a very effective drug. It covers the whole range of most of the things we deal with those potential clotting problems, let's say. Warfarin is able to reduce the risk of CVA by 60 to 70% if maintained in therapeutic range of an INR of 2.0 to 3.0. Only about 50% of the patients that need some type of anticoagulation receive it. And the other scary part is only of the patients receiving warfarin, they're in the therapeutic range of 2 to 3, only about 65% of the time. If they're at 1.8, and let me step back and say that, when we say 2 to 3, that's what's recommended, and that's a normal range for probably 80% of the population that require it. Every lab has a normal range. We've seen people fall out of that range as still being very normal. But with Coumadin, when you're dropping to 1.8, in most cases, you're not protecting them. They've dropped out of the protective range. And when you're running up over